I sure do. I mean, for those that that meet the what we would call, be good patients for, meet the clinical criteria to afford themselves the ability to take that kind of medication and have other issues that aren't going to preclude them from taking it. I think it's, it's the next step of along this this continuum of care for an obese patient. I mean, since when in the United States did we not want to treat diabetes and obesity? It's, two huge problems that lead to a lot of downstream cost of care increases due to other issues. So the obese, I mean the diabetes stuff, we got that covered. That'll be good. The obesity thing we still have to figure out though, and that's not going to be easy because you can, if you think back over the course of your own life and hear about all the different fad diets and the different medication combos and the different surgeries and all the things that have been tried and either failed or mildly helped. This is probably the first one that works so well when taken appropriately and for a long and stay on course and take it for long enough and those that really need it. This is not to be a drug so that you can get 5 pounds off to go take a cool Instagram photo on the beach. That's not what this is for. And that's what people see on commercials and hear about in Hollywood and other places and that kind of stuff. And that's given the wrong message. This is supposed to be for those that are, have truly done and are still doing the lifestyle modification, the diet, the exercise, that all the activities that go along with the nutrition counseling, et cetera. This is not supposed to be some panacea that you take this magic shot and all of a sudden the next day you're ready to run a marathon or something. So yeah, I do think it's a paradigm shift, but within that paradigm shift, we can't forget the tried and true methods of what really makes you healthier, which is to eat right, get exercise, all those kind of things that go along with it. We are seeing less uh, adherence to drug than we thought we would, and and like I said earlier, is the reason because of cost? Is the reason because of side effect, or is the reason because of shortage? We think it's not because of shortage because we go out of our way to make sure those that need it and present a prescription that we're somehow going to get it to them. I can say in my own personal practice of seeing patients, um, I really search for that patient that's highly motivated. Just as a quick aside, if you think about all the back surgeries done in the United States, and you look at the doctors that have really high and good outcome rates from their back surgeries, for instance, it's those that pick the patient with the best ability to have the most appropriate patient for that care that has the best outcomes. And so they're not doing those doctors wouldn't be doing it when it's not needed, and that does happen, unfortunately. And they won't be doing it if they're beyond the point of return to where the surgery is not what's going to fix them. There's some other option. And so I think the same thing goes with this. You got to know your patient. What's the psychology of the patient, the personality of the patient, how ready are they to really treat obesity? And you got to talk them through that kind of stuff and really prepare them for what the side effects are and what the cost is going to be. And that's a responsible way to treat any patient for any disease process, but especially something like this that tends to be so chronic and having so many failures. You probably, I'm sure you know somebody that's had trouble, balancing their weight through their life, and they probably have tried multiple things like multiple diets, multiple exercises, multiple, Atkins diet, all these different things you hear about every year, and have probably failed most of them. Otherwise, they wouldn't be standing in front of you wanting a script for one of these drugs. So I think uh, I think that's probably one of the reasons that we have so much failures. So we're seeing, like I say, anywhere from 40 to 58% of failures on these things.